This video demonstrates an example of an effective environmental services EVS cart setup. Having a cart setup that is standardized within your facility can help the EVS team accomplish their tasks efficiently while maintaining infection control practices. The cart setup may vary depending on the equipment and products used at your facility. Let's look at this example of a cart setup. The top of the cart should store items that are frequently used, like gloves, alcohol-based hand sanitizer, microfiber disinfectant-soaked cloths, and trash bags. Notice that the labeled clean microfiber bin with a lid is also placed on top of the cart for convenience. This will help keep you from bending down too many times. If your facility uses disinfectant wipes, this is where they could be stored. Here's a section for approved facility disinfectants and cleaners. This section is to store the paper products and dispenser refill bottles that will be used during the shift. Ideally, each bathroom has a designated toilet brush that is stored in the bathroom. The unused microfiber mop pads should be soaking in a disinfectant-filled bucket with a lid and disinfectant label. Trash cans need to be covered and easily accessible. A trash bag could be tied to the side of the cart to collect the used microfiber mop heads and microfiber cloths for laundering. All of the carts should be set up the same way for efficient and consistent cleaning. Consider putting a laminated picture of the setup on each cart. Keeping the cart clean is important to protect you and the residents from germs. The EVS cart should be disinfected at the end of each shift and as needed. Clean and disinfect all areas that are touched often or are visibly dirty. Don't forget to disinfect the handles of the mop, broom, and dustpan. Regularly scheduled deep cleaning of the carts is an important part of eliminating germs. Talk to your supervisor to find out your facility's cleaning schedule. Now let's review some common struggles with cart setup and how they can be improved. For convenience, staff often keep their personal items such as water bottles, phones, and keys on their cart. However, these items should be put away in a designated break or staff area. This will help to keep your personal items from becoming covered in germs. Reusable items can carry germs throughout the facility. Disinfecting these items is an important step. Items made of unfinished wood, such as pencils, clipboards, and handles, are porous and cannot be cleaned well. Consider using items made of metal, plastic, or finished wood, which are usually disinfectable. Items that are designed to be single-use, such as masks, gloves, and sponges, should be thrown away immediately after use and not kept on the cart. Sponges and scrubbers can carry germs and should only be used when necessary. When needed, cut to size, use once, and throw it away immediately. Ideally, each bathroom has a designated toilet brush that is stored in the bathroom. If the toilet brush must be shared among multiple rooms, designate a location on the cart that is separate from the other items. Make sure it will not drip onto your equipment or easily knocked over. Cleaning products are provided by your facility. Staff should not bring products from home. EVS carts are sometimes used as storage. Remove any products or equipment that are not being used regularly. Keep your cart organized and uncluttered. The spray and wipe method of disinfection is not recommended. Spray bottles put chemicals into the air where they can be breathed into the lungs. Microfiber cloths soaked in disinfectant is more effective and is recommended. An appropriate disinfectant wipe is also an alternative. Paper products like toilet paper and paper towels should be stored so they do not become wet or dirty. Only keep enough refill supplies on the cart to be used during your shift. Try not to overfill your cart. Tape is often used to solve problems on EVS carts, but the tape residue gives germs a place to stay and grow. Sticky surfaces are not able to be disinfected. Remove any tape and tape residue from the cart and equipment. Work with your supervisor to see if there is something other than tape that you can use. String mops are not recommended because they can lead to cross-contamination. They also require more time and physical effort to use properly compared to the recommended microfiber mop pad. Trash cans should not be used as storage for your equipment. It is important that the trash can lid be kept closed. An effective EVS cart setup can help accomplish the cleaning tasks more efficiently. This, along with having the right tools, can help protect you, other staff, and residents from germs. Thank you to all the EVS teams. We appreciate you and recognize the important role you have in the infection prevention process. If you have any questions or would like to see more videos like this one, please go to www.sdhai.org. Thank you for watching.